So the phone rings, I get a call. Jim, I want to change my treating doctor in my Connecticut workers' compensation case. This is something that happens several times a week and is something that deserves a little bit of discussion here. My name is Jim Aspel. I'm a board certified workers' compensation attorney in Farmington, Connecticut. And if you sustain a work related injury in the state of Connecticut, Connecticut General Statute 31294D indicates that as soon as possible after notification, the employer has to provide to you a treating physician or surgeon to take care of you for your work-related injuries. Makes sense. One of the main purposes of workers' compensation is to get you better. To that end, they provide a treating physician to take care of you. A lot of times, over the course of a relationship between a claimant and their doctor, the relationship deteriorates. Now, this can be because of um, personal disagreements between the patient and the doctor. It may feel that, or it may be that the claimant feels that the doctor is not listening to them. It may be that the doctor has exhausted any available treatment plan and has nothing else to offer the claimant, and the claimant is still in pain and wants to try something else. In those instances, that's when I get the phone call, Jim, I want to change my treating physician. Now, you would think that that would be an easy proposition. Unfortunately, it's not. Connecticut workers' compensation takes the appointment of your treating physician as a pretty serious matter. And if a physician has been taking care of you for a period of time, 2 months, 3 months, something like that, and you're engaging in treatment with them, they've prescribed physical therapy, they've done diagnostic testing, the administrative law judge isn't for, on a whim, going to entertain your desire to change the treating physician simply because you don't like your doctor anymore. Um, Generally, there has to be good cause to authorize a change in treating physician, and it's not something that administrative law judges uh, entertain lately, primarily because they want to avoid the claimant doctor shopping. A lot of times, what we see is that the treating physician returns you to work. Uh, you, the injured worker, don't think you're ready to go back to work. And then all of a sudden, you want a new doctor who's going to see things your way and perhaps keep you out of work longer than the original doctor felt was necessary. In that instance, that change of treating physician is in all likelihood not going to be approved. Now, there is a statutory section that addresses the change of treating physician, and I just want to go over that with you pretty quickly. Again, it's in 31294, and it's subsection C. There's a number of subsections to the statute. And what it says, and I'm going to read this to you, it says the administrative law judge may, without hearing, at the request of the employer or the injured employee, when good reason exists, and that's the key phrase, or on his own motion, authorize or direct a change of physician, surgeon, physician's assistant, or advanced practice registered nurse, or hospital or nursing service provider pursuant to subsection A of this section. Subsection A is that section that I was speaking about earlier that says that they have to provide you a doctor. So again, in that subsection C, almost 40 years of practice tells me that the operative phrase in that whole statutory section is when good cause exists. Um, so just keep that in mind if you're looking to change doctors. If you've got a legitimate reason, the doctor has nothing else to offer you. Sometimes the doctor is going to say, there's this new technique that I think you really ought to try. And I don't know how to do it, but Dr. Jones here in my practice just took a whole course on it, and now he's very proficient in doing it. In that instance, then yeah, the administrative law judge, in all likelihood, is going to approve that change of physician. Um, Sometimes you'll get a really good-natured comp defense attorney, and they'll go along with the change of physician without putting up a fight. I would say that's very rare, but it does happen. I've seen it happen. Um, so just keep that in mind. When you pick your doctor originally, uh, keep in mind that they're going to be like your spouse. They're going to be with you for a good long time, unless there's really good reason to change. If you have any questions about picking a doctor, um, somebody who you think would be appropriate for your particular injury. If you have a shoulder injury, you want a good shoulder doctor. If it's a knee injury, You want a doctor who's got a lot of experience in knees. Likewise, if it's a hand case, obviously your hands are very important. You want to make sure that you get a first-rate hand surgeon to take care of you so that you get a good outcome. In that instance, it's always worthwhile to consult with a workers' compensation attorney. Anybody that's been practicing for any period of time is going to know which doctors have pretty good surgical outcomes, which doctors have repeated bedside manner issues with their patients, which doctors the patients absolutely love. It's like anything else in life. I mean, there are different people, there are different personalities in doctors, and generally, your workers' compensation attorney is going to have a pretty good idea who to match you up with. So hopefully that helps. Changing treating physicians, not something that happens lightly. So use some care in picking that doctor out initially. If you liked this information, I'd appreciate a thumbs up. Subscribe to the channel. There's a lot of topics on Connecticut workers' compensation. If there's something that you'd like me to talk about, if you have a particular question, drop it in the comments, and I'd be happy to make a video about it. You can always give us a call. We're in Farmington, 860-523-8783. You can check out our website, ctworkinjurylawyer.com. There's a lot of Connecticut workers' compensation specific information there that you can read through as well. Okay. Hope you found this helpful, and I appreciate your time. Thanks.